Lung qi deficiency. This is due to declining function of the lung in governing qi and dominating the way defensive function. Clinical manifestations: weak cough and dyspnea, shortage of qi, shortness of breath, which is worse on exertion, clear watery sputum, low voice, spontaneous sweating, aversion to wind, tendency to catch cold, mental fatigue, tiredness, pale complexion, pale tongue with a white coating, and a weak pulse. Key symptoms: weak cough, dyspnea, low voice, and clear watery sputum with other symptoms of qi deficiency. Lung qi deficiency will cause lung qi failing to disperse and descend but ascends adversely. And inadequate zong qi will weaken and breathing function. So both will cause weak cough and dyspnea, shortage of qi, shortness of breath, and low voice. Lung qi deficiency can also cause more qi deficiency depletion after exertion, and this will lead to more severe cough and dyspnea. The lung is unable to disperse body fluids, which form phlegm, so the sputum would be clear and watery. Lung qi deficiency can also cause disturbance in the way qi, leading to spontaneous sweating, aversion to wind, a tendency to catch colds. Lung qi deficiency will lead to weakness of lung qi, causing pale complexion, mental fatigue, or tiredness, pale tongue with white coating. To summarize, lung qi deficiency etiology: hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness, weakening lung qi, repeated impairment of lung qi, diffusing and descending over long time. Signs and symptoms: shortness of breath, panting, worse on exertion, forceless cough with profuse watery sputum, weak voice, spontaneous daytime sweating, dislike of speaking, pale or bright white complexion, easily catches colds, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling of upper back, absence of thirst, pulse, weak, especially right front position, tongue, pale, slightly wet, white coating. Treatment principle: strengthen lung qi, support defensive exterior. Acupuncture treatment: to supplement lung yang, we use lung 9, and to promote descending of lung qi, we use lung 7. To supplement original qi and fortify yang, we use Ren 6. We use bladder 13 to supplement lung qi. Do 12 is used to relieve cough and dyspnea. Stomach 36 to supplement stomach and lung qi. Ren 12 to supplement earth to strengthen the metal. Bladder 43 to supplement the lung. Bladder 20 to supplement the spleen. Spleen 3, the source point of the spleen. Needle with supplementation, and use moxa if required. Because this is a qi deficiency condition, the advice given for spleen qi deficiency and kidney qi deficiency will also apply here. That is, the person should eat a diet that is nutritious but does not weaken the spleen. Food that is white in color will often have an affinity with the lung and can be used to focus qi tonics on the lung. The person should avoid consuming food that is very spicy because it will spread and thereby weaken lung qi. Foods that particularly strengthen lung qi are turnips, daikon, radishes, parsnips, parsley, onion, garlic, tofu, herring, walnuts, almonds, cauliflower, dates, figs, duck, tuna, grapes, thyme, and ginseng. Ginger tea will also be beneficial. It is important that a person who is lung qi deficient does not strain their voice because it will weaken the lung qi. A person with lung qi deficiency must ensure that they get enough rest and do not overexert themselves. However, light exercise and movement will be beneficial because they will open the chest and support the lungs' qi mechanism. Going for walks in fresh air will be salutary because the person will get some light exercise and the fresh air will nourish the lung. Yoga and Qigong often utilize breathing exercises that have a beneficial effect on lung qi. It is important that a person who is lung qi deficient is conscious of their posture because a slouched, slump posture and sunken chest will strain lung qi. If there is an emotional aspect to the lung qi deficiency, the person should try to resolve these issues. Thank you for your attention.